Welcome. Today is a big day. You are at the University of Minnesota. You are at one of the greatest and largest universities in the United States. This is important because you come here as the future of the universities and academias in the United States. And I know this because each one of you are unique. Each one of you are here to show something, to understand something, to deeply dive into something that will give you new and unexpected ways of thinking and new unexpected ways of contributing to that future that you will generate, that you will own. And the reason I know this is that I have been at this university for 27 years and I have trained at other universities, and I know that you will deliver exactly on these promises because we train everyone from the very beginning of life to the absolute end. And we train people who assist those at the very beginning of life, like pediatricians and neonatologists, all the way to the morticians. We do train 73% of the doctors in the state of Minnesota. That's a lot of doctors. So when you are in Minnesota, you will probably be taking care of a doctor that we have trained. And there are more than 800 doctors that actively treat patients at this medical school. Now, you will see that where we are really different than others is that we serve communities. We listen to the communities, we come and say, look, can you teach us what you need? Can you tell us what you as patients, as families, as communities, what is it that you really need? Because we have, and you will have, today, a great opportunity to be a participant in this and to really live that same experience. We are looking at disease and health, not just like doctors. We are doctors, but not only like that. We are looking at this as scientists. We are the only place that you can have in the state of Minnesota that can really take the disease apart and look at why is this happening and how can we do this better? How can we do something that has never been done before? Because the ultimate goal of ours is that we will leave this university and this academia and this medical field a little better place. Like good guests, a little cleaner, a little more organized, a little more responsive to where you are going. And that's where you fit in. That's where you need to pay attention. Today, you will have doctors and others tell you about cancer. Cancer is very common and it's very, very different, than we felt cancer has been even 10 or 20 years ago. Cancer is not a single disease. It's a many, many, many diseases. And it seems to us, with the understanding that we just very, very recently accumulated, that it is different in every single person. So what we do differently than others is that we don't have one recipe for everyone. We have a single tailored, focused treatment and management for every patient with cancer that we see. So as you go through the day, as you listen to people that have done this for a very long time, look at where do you fit. Where is it that you can be interested or where you can imagine things that nobody else can? Because as I said at the beginning, you are unique. You are one of the kind, and you will be the ones who will find things that nobody else will find. And the recommendation that I have for you is realize that everything is changing. The society is changing, medicine is changing, you are changing, and everything is connected. So you pay attention at every single turn of these events. So I wish you the best possible day you can have, and I'm delighted that you are one of us, and have a wonderful day.